I actually wanted to be a doctor when I was a kid, and I started volunteering at the hospital while I was in university, so I decided that nursing was the path I was going to take. I started to identify a lot of patients or scenarios that didn't necessarily need to be in an emergency department. I decided to start doing just stuff I was good at and stuff that I liked on the side. So I hired a foot care nurse and I started doing blood collection, and then things just started progressing from there. The biggest economic challenge I would say that I had to overcome was reconciling to the fact that if I did this as an entrepreneur, there's potential consequences or outcomes related to finances that are going to be a challenge. And actually that's a lot of where Enloe came in. These guys that really believed in me from the beginning, and so accessing that capital allowed me to overcome the barrier of what I required personally, financially, in order to really get into the meat and potatoes of what this business was eventually going to become. I think that a lot of the vision that I had when I started this company is really just in its infancy stage. I think that there's a lot of impact that we have yet to realize, coupled with the fact that there is such a strain on the healthcare system. Knowing where some of the needs are, knowing what some of the gaps are, and having some really creative solutions around how we can improve those. There's things that you can take out of the hospital right away that will have a significant impact on the cost of healthcare delivery, and also on the impact and recovery time for the patients that are kind of at the mercy of having to wait for when the system is able to accommodate that. To be able to help patients that don't have access or have questions, we take a lot of acute care, for example, now, and bring it home. We've got appropriate oversight and professionals that are keeping an eye on our patients, and the communication, the health authority with the Department of Health, primary care physicians, specialty physicians. You've got to have those lines of communication open to make sure that you're doing justice to the patients. What is their actual needs? And when you can identify that and that be your driving force, it'll serve you well for a very long time.